Now, Cecilia is a psychologist and works in a mental health institution where they have a garden under the brand Semilla. They receive inpatients from the hospital and residents, sort of chronic psychopathology. They run various activities overseen by psychologists. Cecilia completed 4 courses in horticulture therapy in the Horticultural Therapy Institute in Denver, and has developed several community gardens. So really looking forward to hearing Cecilia's presentation, and I will hand you over to Cecilia and it'll all go swimmingly. Okay. Thank you, Cecilia.
Hi, good morning, everyone. What an honor. I see a couple of names that I know, and I'm so pleased to have the opportunity to get to know at least a little of some of you. I'm going to try to be very clear so we can have time to share at the end. I'm so excited to be here. I know I belong to this community, and really it's such an honor to be part of it. I think that, well, I do not only, I may be, it may be similar with other people here, but I do not only practice horticultural therapy. I do other kind of therapies and different kind of jobs that involves mental health and very administrative work. But my passion is this, I swear, and I feel so happy to have the opportunity to share a little of me and the work we have been doing here. Well, Miss Semilla project, it was an idea. It started at 2017, and well, our objective is to just promote mental health. By the time goes by, it has been incorporating other components, important components to cover the needs that people around here have. It's good to know also that in the hospital that I work, it's been like almost 200 years of work with social work and mental health in my country, the first one and the most important maybe. And it's such a, like, I'm so lucky that I could like promote this therapy, because I do work with a lot of psychologists. I'm actually the responsible to bring psychologists to do their intern, and also psychiatrists. And let me tell you, it hasn't been very clear or good to understand horticultural therapy here in Ecuador in 2017 after pandemic COVID. Of course, it seems much more logic that to incorporate nature in as a complement for mental health, and that makes me very happy to just be lucky, because I didn't look for it. It only came to me. And I really want to just take a minute to share how was it. I started doing gardening for my own health. My father and my husband, they are agricultural engineers. You know, in Ecuador, very common from, well, in the world, agriculture is one of the main professions that have bring us here. And well, I started learning, but it was very, very personal. I didn't like take courses or classes. And that's what I always say, that nature, our understanding of the nature comes naturally to us because we're part of it. And we have been growing thanks to it, and taking advantage of all the different processes and stimulus, and also nutrition. So it's not hard to get to know or understand nature when we are willing to it. So I was a student about that time still. I graduated, I think, 1 year later. And that only can happen in Ecuador to be like a student. I was communications, I had a communications degree before, but well, I was not a professional in mental health. And in most of the countries, you don't do it until you get a PhD. Here, it's completely different. And I was like incorporating a tool that I didn't know how to use that it was obvious to me, but I didn't have much guidance. I brought in a friend of mine that already had his title, his like bachelor's title in psychology, and it wasn't enough. But maybe it was because only here in Ecuador we were able to, like work with groups of like 15 schizophrenia, chronic schizophrenia patients. It's so hard because of policies, legal policies, to do this in different other countries. So I was lucky with that too. And also the vision of the person that was in charge ahead in that time was so open to be more human with patients and scientific too. So I proposed this project. I had my first interview with male patient in urgencies in the psychiatric hospital, and it came to me so clearly how horticulture could benefit these people, that if something they know, it's about agriculture, obviously. This is a hospital that receives mostly middle or low class category, economic, social status. So they didn't have education, symptoms, schizophrenia or bipolar or so many other diagnoses. Diagnostics begin with their first signs very early even in youth. So it was very hard to them to get a diploma, even their bachelor's, even their a high school degree was hard to them. And also above that, or on top of that, they have been very exposed to drug dealing and a lot of violence, which is something that common in every country, no matter third or first world country. Violence is characteristic in our society. And that's how horticulture therapy is so magnificent, because it not only states in the neurobiology, which is my main, like discovery, and it was not even at the beginning. Of course, at first, I identify the physical benefits, because being in a hospital deteriorates many functions of you, physical functions, but also in the mind and the brain. It's another muscle for us, another muscle of our bodies. So it has to be in constant activity and exercise. So it was perfect, because horticulture makes you be learning all the time. And also social benefits. You get, like this you can develop these abilities so important that makes us humans, this sharing with other people, and feel that you belong to a group, and let us, as a psychologist in the garden, collaborate and contribute with the process of mental health they are going through. But then it comes the values, going back to violence. It's so characteristic in our childhood, and thanks God things are changing and we have more information, and we know that hitting and screaming, it's not the best way for our brain to work, and that's what anxiety is, a lot of fear. So the garden gives you all that sensibility you need to reinforce also your values. I think that's one of the best characteristics of this therapy, and of course how we get conscious to environment, which is everything. So this is our garden in good days. Now we have a lot of rain, and it's been hard for me getting, that's why it's called this seminar, it's a reborn, because we just last month reopened the garden. These pictures are before 2020, before pandemic. I wasn't able to come here to the hospital for a lot of time. And also patients need to be apart one from the other. And this therapy, it's integrating, and especially because the system and the hospital needs to have a lot of audience. We can do like one by one and this kind of therapy. So it was very hard, and also I have other responsibilities in the institution. So it's been frustrating, but it has been enough for me to keep motivating myself and my team to continue to this beautiful work. So we have criteria to make it a therapy. Of course, I've learned through Rebecca and all the group of Horticultural Therapy Institute in Colorado, which is one of my best experiences ever. I miss it a lot, and I got so happy when I saw Rebecca. I saw also another friend from Peru, Silva. It's very motivating having you here, and I know that this to be a psychotherapy, because I'm a psychotherapist. I'm a psychotrauma specialized, and we know that we need psychologists. We call here in Ecuador clinic psychologists, because you can get a bachelor's in clinic psychology and organizational psychology. I have both, but I know that for you it will be just a psychologist, which that's the need. But to have clinic experience, and if you come here to this hospital, you do get it. We always need to have horticultural training purposes, even with chronic patients. It's a very conductal way of working with them. It's not cognitive, like cognitive may be the best psychological theory to work with us, but with chronic diseases in mental health, conductivism is what it works for them. So even though they don't get new memories, okay, they do follow commands. So it's still they need, and they learn. Maybe they don't remember how to do it, but they can follow all this guidance that you do in the garden. And we do application of validates diagnosis tests and symptoms. We have been always working with positive and negative schizophrenia symptoms. I remember in that time, in 2017, well, investigation research has been growing up so much, but at that time, having the tools to evaluate these kind of symptoms was already a challenge for me. And we developed also a scale that I've been, have almost 200 schizophrenia persons, so I can validate. So that's what I try to do now. Another criteria is the philosophy paradigm that we follow, which is complex thinking of Edgar Morin, this French philosopher, that gave me all that, that all the steps I need to follow to actually have a therapy that theoretically it's supported. So that's what it worked for us. Also, we use as psychologists third generation therapy techniques, because these techniques are the ones that work with our neurobiological part of our brain, and well, that's what nature does. It actually impacts directly to our neurobiological part of us as human beings. And third generation therapists, they do also DBT and ACT from Stephen Hayes and Marshall Linehan. These are the most, like newest therapies that incorporate a lot of meditation as a component, as a principal component. And what better than meditation? I have a beautiful anecdote in which I was always incorporating this kind of metaphor, which was a technique of the garden, obviously, because we're in a garden, and you know, like meditation, incorporating a very experienced features in the therapy. And first time that I read Stephen Hayes, which is one of the main theory creators of ACT, which is a therapy of act and compromising. And I read his metaphor of the garden, and I was like, what? Who is taking away and being and possessing my metaphor? And it's been written for so long. Same with horticultural therapy. The first time that I understood all these benefits that it can bring, because it makes people occupied in a good way. That's what the first thing I figured out when I had my first patient, my male patient, that he knew about horticulture, but he didn't have the chance to have a career. So he went back home and came back again because he didn't have anything to do. That will get us crazy to everyone. So he didn't have that kind of tools, and horticultural therapy and its vocational benefits for me was the key point to understand how horticultural therapy works. And I came back home and I started reading, and I was like, what? How could I ever heard about this? It's so obvious. I've been working with this and I never Googled it. So it was like an epiphany for me. And I didn't know about third generation therapist techniques that was what I needed to support my therapy and present all this important information to all the doctors and psychologists that were like, yeah, here comes the psychologists that like plants. You know, like I didn't mind about that label at all, but it was much more than that. It actually has scientific proof, and that just gives me like a relief, like, yeah, I knew it, you know. It convinced me about it. And of course, all the benefits that we all know: physical, cognitive, emotional, and social benefits. Again, I'm very lucky because I bring a lot of professionals. Like I get to know a lot of psychologists and psychiatrists too, which are so little here in this country. It's one of our main problems in mental health. So I get to present a lot of people this new view of mental health, which need to be incorporated, which needs to nature be incorporated to it. It can't be apart. And without knowing, getting to Semilla or getting to horticulture, it's getting me to research a lot, and without working on it or want it, I do the research in this institution. So I'm learning about research, and that's helping me a lot because it's what I really want to do, to share all my knowledge or experience. That I know there's so many people with more experience and more abilities than I do, but we have here so many patients and needs that I think that we have so much needs that it's an opportunity to us to incorporate this kind of therapy. And we have also this kind of legal authorizations to do it, which it's not possible in most of the countries. So what do we do always? We are basing a group therapy format at the beginning of every session, because we have to know what's the state of mind of each of the participants. I have to be honest, we should never have more than 12 people, but I have so many people sometimes because we don't know how to say, no, you can't participate. But it should, you know, be just 12 maximum people if we have the people to get to do the activity, because it needs help, because many people have many different difficulties and yeah, physical difficulties too, not only mental, of course. So we have like this bank of procedures of horticulture, which incorporate the technique that serves to work to something. Okay, so we plan weekly to, okay, what's the needs of the garden. We have these activities that are already written, and we have depressive patients, so we are gonna focus that intervention in working that, which is different if we have a person that comes with drug abuse, or different if I work in a community garden. But the activity has its structure, and we, with our knowledge of clinic psychology, we focus the intervention to cover the symptoms they have. So it's personalized. It's not like a structure that it's not flexible. Everything has to be flexible in human beings, of course, in mental health also. And we also use a scale based in patient's functionality. This scale, someday I guess I'm gonna be able to share it, because it's been a very good tool for me. So we validate different with different criteria how it's getting better or not our patient in different aspects, like compromising or understanding of the command, or initiative, or dissociation, for example. Yeah. And yeah, here it is: initiative, teamwork, accomplishment, commitment, comprehension, dissociation, motor skills, impulse control, emotional liability, and memory. So that's what we evaluate with that scale. And well, as I said before, we have this like bank of techniques that are our tools to work in our therapy, characterized by their benefits. So we have this, activity, and it has in physical these benefits, in emotional these other benefits, etc., etc. Okay, so we keep documentation. I haven't been able to actually do the publications I want to do, but I'm working on it. So I hope I can share some of my work scientifically someday. Activities organized weekly, and I want just to give a closure. We do have alliances for vocational purposes with universities, so we can give certificates that at least they know about horticulture, and they cover a certain knowledge to get that diploma, so they can, re-enter to society. And also alliances for research projects with universities and private institutions too. Since I'm our organizational psychologist, and I work with institutions too in mental health preventing programs. Gardening, it's a very good option in enterprises, as you know. And we just had this beautiful event. I was so happy to reopen this service. We did it thanks to a group of patients that are intern patients in drug abuse. And this is Jose Jimenez. He did a great job. He's engineer. And my students, because we have a lot of students that were integrated to these activities, were so happy to learn about drug abuse. So I always say this to my patients: I am here in this same place since 2017 when I was a student, because of them, because I keep on learning about this profession, that it's my passion. And my favorite tool, of course, it's when I can incorporate plants to the well-being of the people. So yes, I'm so pleased to have time for any questions, or just in time to share a little. Well, I see there's some in the chat. Or you can open, I think, also your microphones.
Yeah.
I have to share. I'm so sorry.
Will you want to unshare your screen and then we can see everybody, Cecilia?
So we can see
And
each other.
then we can see the bodies. That's great. And as you say, we do have some time now for questions. So do we have a couple in the wee box, and then anybody who would like to ask a question in person, put your hand up on screen and come up, and we'll be able to get you there. Okay, so who's
It's
going to
it's me, Linda.
All right.
Hi. Cecilia, thank you. That was brilliant. So just a message, I don't know if you've seen it, from Andreas, just saying he had to leave, but thank you for your presentation, and he's sure he'll watch it later. So that was that one. Fiona's first question is, it's great to hear how you introduced and practiced therapeutic horticulture with patients and residents in the hospital. The scales that you mentioned, are they available internationally? Is that something that's publicly available, or is that something because you've developed them, is that something that's available for other people to use?
Well, it's one of my most appreciated, creations or accomplishments. I know I have guidance with doctors that they know our research, and they're helping me getting all that information together, and luckily being public in these coming months. But I'm so willing to share still the tools that we use if it helps to anyone. But no, I don't have it translated in Spanish either. I share also that I've been collecting all the evaluations I have because I know that to validate its scale, you need at least 200 people that have been evaluated with, and also a process that I have to go through. But I think that it's very useful. It works for me very much. So I will be pleased to share when I have the work done.
Brilliant. Yes, I'm sure there'll be lots of people interested in that one. I had a question just on the same thing about the scale. How often do you evaluate the patient's progress over time? How often is that done?
Well, we use three different evaluations. One of them not validate, that is the one that I use. But we use PANS, which is positive and negative schizophrenia symptoms. And this is only to know which kind of a schizophrenia patient it is, if it has more negative symptoms or positive symptoms. Okay, so it's more hallucination and delirium, or it's more abilities of share expressions, share with others, which are these negative effects, more conducted to depression. Okay, and we do evaluate again after 3 months, but we haven't find like different development or changes, significantly changes. And it's not our purpose. Our purpose is functionality. No matter how many delirium or hallucinations they have, because they are never gonna get better in that sense, in that area, because they're chronic patients. They live here. They've been living here for decades. But what they, and we can prove that they get better with all these other functionality. They start taking care of themselves with our techniques. They start managing better their emotions, and also their acting, so they keep more distance with others. They don't ask for money. So that's what we can prove, and we do that with the scale that I was talking about. We also evaluate neurocognitive capacities with neuropsy evaluation, which demonstrates how intellectual disability is shown, and with that we can say that they can be whatever schizophrenia symptoms and diagnosis they have, or intellectual disability they may have, they still are functional in the garden, and it goes also to their personal life. So that's how we do evaluate every 3 months.
Fiona, you've got your hand up. Do you want to just unmute?
Thank you. Hi, Cecilia. Thank you. That was great. I wondered if you had had you noticed some benefits and outcomes in the patients that you feel are benefits that are unique to the therapeutic gardening, which would help you to justify the continuation of the project, I guess, something they don't get from other interventions.
I'm sorry, Fiona. It just was interrupted a little time. Could you repeat?
Yeah, I saw my internet was a little bit unstable. Sorry. Can you hear me now?
Yes,
Yeah.
perfect.
I wondered if you had noticed any outcomes and benefits that were unique to the therapeutic gardening that you don't see from other interventions, which would, of course, help you justify the therapy and more funding and support.
That's an interesting question, because that's the path or we should follow, right? What we see that it's different from other therapists. I think that the connection with the therapeutical connection that they have with us is completely, us, the ones that we work in the garden. It's different than the ones you have with psychiatrists, and where they are getting their treatment, because it's so distant, and the institution has so much stigma, and it's so socially challenging for everyone. And psychiatrists, maybe not everyone, but maybe very, like closed to the medicine and the 20 minutes they have for patients. It's a system, it's a hospital system that it's cold, that it doesn't help to actually get a connection with your patient. Okay, so when we go to the horticultural therapy, we don't have like hierarchy, or we just I have, like soil in my face and in my teeth, and that makes them feel so comfortable. I think that actually they have a good time, even though, and that's the magical thing, because psychology is nothing else, and mental health is nothing else than living the present, because it's the only reality that we have. So when they come to the garden, all their brain is working thanks to all the different experiences we're living that led us the opportunity to live the present, even though the reality they are going through, which is hard.
Thank you. We recognize that here from our experience here. That's really interesting. Thanks.
Yeah.
Anya, lovely to see you. You have your hand up. Would you like to unmute?
Yes, Fiona, I wrote my question on the chat. Yes, about the use of SMART goals, because we do use it, and I find it's very efficient for the evaluation. I want to know if you, because I find this a very smart way to evaluate. So, okay, what about it?
Hi, Anya. We share a course in horticultural therapy. It's great to see that we keep on it. Well, I don't see, I'm sorry.
I don't see it.
But I understood it. You are talking about, and since I work very in organizational contexts too, the SMART list to make something measurable with objectives, with clear objectives and time lapsing. Yeah, totally, it's great, and I think that it's a great contribution, and I really appreciate it, because I haven't written down, but we do follow SMART methodology to the work that we do, but I haven't written it down, and I think that it's a very, very contributing tool, but just let me know if that was what you were referring to.
Anya, does that answer your question?
Oh, sorry. Yes, just to know if they use it, because for me it's been a great tool since the beginning when I finished my class of the Horticultural Therapy Institute, and so I found this is very effective and quick and easy. So we use it a lot. I
Totally agree. And since I have
but
this,
we write it down.
see,
We do
great.
that.
Thank you. I'm totally gonna get this this idea to make it more efficient, basically. Thank you so much, Anya.
Linda, you had your hand up briefly. Did you have a question?
Sorry.
You're on. Yeah.
Go to Rebecca. Yeah,
You sure? Okay, Rebecca, do you have a question for us?
Yes, can you hear me?
Yeah.
Yeah, so Cecilia, it's wonderful to hear your work. Thank you for doing the presentation. So when you're working with the other psychologists and other people, are there written goals that someone else creates for the patients that you serve? Do other people write treatment goals?
Yes,
Like,
we have,
maybe you don't have specific ones for horticultural therapy, but are there goals that you can work on that are already written by someone else? I'm wondering.
okay, we have different areas and with different completely kind of patients. We have residencies where they live there and they've been living there for decades. And the goals there, they don't have personnel, they don't have nurses important for these kind of activities. We don't have enough practitioners. Okay, so it's been very hard and challenging trying to take all the needs they have and do well work with them to evaluate how they are becoming better or not. But we do have in the hospital, which is another area where people comes through an emergency, maybe for a psychotic symptom or suicidal acting, and they are here for 1 month, more or less. Okay. That's how our law is, and it's been reinforcing to do this kind of ambulatory job with psychiatric, which is what the world is doing and trying to not take the patient out of the society, but actually get it back, put it back. And the goals are there, and we have very good practitioners there that have to follow the national requirements, which may be very conducted to bureaucracy, not much to therapeutically objectives, which doesn't mean that they don't have therapeutical objectives. But I think that can get better. But for the time that they need to be here, the objectives is to reduce the hallucinations, deliriums, start receiving the medicine. That's what it's the focus in the hospital, in patients. Just, like very psychiatric. Of course, they do receive psychology, but very directed to insight, to make them understand they are sick and they need to get their medicine and begin in a treatment, therapy, and also psychiatric therapy, so they can go back to society. I think that the goals are more reduced to that.
So just to follow up, so they all are working on something, obviously, and it's probably really parallel across people. They just aren't necessarily individualized with really specific objectives for each one. That's what I'm kind of understanding.
And I mean, the main objectives will be that they go out from here having a treatment, and the family knows what to do and how to do the follow-up with the medicine they need to take, and of course motivate them to get also a psychotherapy. That's are the goals, but there's not much you can do with this kind of patients in 1 month. So they just leave from here and they go to the garden only people that are here because suicide, and the ones that has this is administrative differentiation, people that pay for the service, because even though we're private, we are part of the health system, and nowhere in the city we have hospitals other than ours, which is private. It's an ONG. So it's very, and I know that everyone hearing, it's very, the difficulty of this therapy is that we have to follow a system. We have to, get into a system. And when it's in hospital or in residence, the priority is the productivity. I know it because I'm part of the administrative, I'm part of the group of bureaucracy. So I know that we have to complete, and we have to follow what the Ecuadorian health system needs, and the reality is that all of workers are trying just to get that kind of how they are evaluated is how many patients do they have a day. But I think that this is shared with many other countries because we share the same problems. We don't have enough practitioners. We don't have a percentage of our money in the government directed to mental health. We don't have a law in mental health. We're working on that. So yeah, well, thank you for your question, Rebecca, and it's very relevant. And we try to collaborate with other areas so we can have better objectives that has better impact to the people here. Thank you. And it was so nice to hear you, Rebecca, again.
Thanks, Cecilia. I've got a couple of last questions. Hopefully we can squeeze them in. So Fiona had asked, is therapeutic gardening used in other settings in Ecuador, or are you quite unique?
Well, I can say that I've been very unique for a lot of years, but now my founding was with the municipality of Guayaquil, and it was the first mental health program they have, and definitely the first horticultural program they have. Now, and I got finance for that until the pandemic began. Now, they have big programs in mental health, not only not necessarily horticultural therapy, but they do have programs in horticulture, and they have programs in mental health. And they actually are going to help us to get better our garden, and they are doing that with a lot of gardens. So naturally, all these new gardens that we have in the city, they will have a component of health, because we got to that once we started working with plants. So no, it's not unique. Now it's getting bigger, and I'm good and happy for that.
Yeah, that's good news. So Linda, this is our last question from Linda. Do you have separate diagnostic groups in one session, or are they diagnostic specific, or is it a mixed group of patients?
Well, it's depending in the area, and in the area they are categorized, but I don't choose the patients. I get the patients that are ready to go out of the hospital, of the infrastructure, very closed and locked of the hospital, thanks to the psychiatrists and psychologists that do this list, that okay, they are ready to receive, to go out from here with less risk of running away, for example, or harming themselves. because the area that we bring people is this area with suicidal symptoms or acting, and people that pay privately that may have depression or bipolar disorder or schizophrenia, and also suicidal thoughts. So this is one group. And we also have another group which is the residency, where we have mixed, but they work in the same area, they live in the same area, so they actually have a lot in common, even though the diagnosis is not the same for some reason, you know, like they start having the same symptoms than other people.
Lovely,
So
thank you.
They are homogeneous groups.
Thank you. Linda, I have no more questions unless anyone else has got wants to be quick and get one in.
Get another question in. Well, I suppose maybe I could get another question in. I was interested in asking about the groups, because in a way your model is not psychiatric, is it? So it's quite difficult that you're presented with people with psychiatric problems, and yet your model of understanding the difficulties or working with the difficulties is in another concept. And I just wondered how that worked. But you answered my question. It's very, very interesting. As a psychotherapist, as a talking psychotherapist, I'm very interested to understand how horticultural therapy fits into a large institution, as you've described. It's absolutely fascinating. And I wish we had things like this over here. It would be wonderful. It'd be wonderful. But I think probably it's time to finish the session. And thank you so much, Cecilia, for sharing your work with us. You can see that it's stimulated a lot of